And thank you everyone for being here. You have folders at your table. Feel free to utilize those. Again, my name's Dave with TruLync Medicare Advisors, is a Medicare agency owned by the Minnesota Credit Union Network. We started that a year ago in May to offer Medicare services to credit union members across the state. Last fall we started with 6 credit unions, and we've signed up 30 now that will be helping through the fall and into next year. So thank you for being here. Anytime during the presentation, if you have questions, just go ahead and raise your hand and ask as we're talking. We want to answer your questions as we go along. So with that, we have partnered obviously with South Point Credit Union. I used to do a lot with South Point members years ago. I was with another agency and we did a lot of business in Hutchinson and New Ulm. As I told Tom a while back, I've sat at more kitchen tables in this area than I can count. So glad you're here. So we're going to talk about the basics of Medicare disclosures. We represent all the carriers for Medicare Advantage plans in Minnesota, Medicare cost plans, and a lot of the Medicare supplement plan options that are available. In McLeod and Meeker County, you have extra options than some of the other parts of the state do. You have Medicare Advantage plans, you have Medicare cost plans, which aren't in all the counties, and then there's also Medicare supplement or Medigap plans, and we're going to go over that today. This is an educational event, so there won't be any sales today. If at the end of the event you want to meet with myself or Michaela one-on-one, this is in your folder. If you fill that out, whether you're on Medicare now and want to review for the fall, we can set up an appointment for the fall, or if you're new to Medicare and haven't signed up yet, we can set up an appointment with you when the time's appropriate to meet with you one-on-one. We can either meet with you at the local credit union branch, or we can come to your home to meet with you. Our agenda today is why TruLync Medicare Advisors. What is Medicare? What does it cover? What doesn't it cover? What are the enrollment periods and the deadlines that you need to be aware of? What are your costs that are associated with Medicare? What if I decide to work past the age of 65? How does that work if I don't want to go on to Medicare right away? And then private insurance options. So if you watch television at all, especially going into the fall, you see TV ads galore with William Shatner and J.J. Walker and Joe Namath asking you to call this 1-800 number and they promise you the world. A lot of those benefits aren't available in Minnesota, so my advice is don't call that 800 number. You're giving them permission to call you until they sell you something when you do that. So unless you love having telemarketing calls, you're probably wise not to call that. You also get a lot in the mail box around the time you turn 65 and thereafter, everybody wanting your business. We're hoping to earn your business as your agents with Medicare. So again, at our services, it doesn't cost you anything to use TruLync Medicare Advisors. We're happy to come meet with you and advise you on your situation, review your prescription drug plans, the medications you're taking, make sure your doctors are going to be in network with whatever plan you go with. You don't pay us anything for that. If you sign up for a plan under us, we get paid a commission by the insurance carriers. And for Medicare Advantage plan, the commissions are the same no matter what carrier that you go with. Medigap plans can differ a little bit, but we aren't biased in what we're trying to sell you because we get paid the same no matter what insurance carrier you go with. And we do offer multiple companies, as I said. We offer all the insurance carriers that offer Medicare Advantage plans. We offer multiple insurance carriers that do Medigap plans, and then the prescription drug plans. We're available for your questions throughout the year, and then every year, once you're our client, we're going to review your medications to make sure that the plan you're on this year is still going to be your best option next year, and if it's not, we're going to help advise you on choosing a plan that will be. There's major changes coming for January of next year with prescription drug plans. The government has changed the rules, and we're going to go over that in a little bit. We're going to help you understand when to enroll in Medicare A and B, what documentation, let's say you work past the age of 65, there's a form your employer needs to fill out once you do retire past the age of 65 so that you don't pay a penalty for not signing up for Part B when you turned 65. We can help you with that. all these other things. How does Medicare impact HSA contributions? If you're turning 65 and you're going to continue to work, people often say, well, my friend said go ahead and sign up for Medicare Part A because I don't have a monthly premium to pay for that. If your employer plan is an HSA, a health savings account, you don't want to sign up for Part A because you would no longer be able to contribute to an HSA. So that's important to know. And then we're going to help you avoid the late enrollment penalties, and then understanding what is guaranteed issue and what is the enrollment periods for that. So, original Medicare. Any questions on that? Okay. Original Medicare. This is what you get through the government, through Social Security Administration. There's Part A and there's Part B. Part A, you don't have a monthly premium to pay. Part B, this year the monthly premium is $174.70 a month. That premium can fluctuate from one year to the next. It's normally announced in October or November what that change is going to be, but it can change from year to year. And then if you go with a Medicare Advantage plan, you don't have to concern yourself with the deductibles that are shown here. With Medigap plans, that may be something we would advise you on. But Part A is coverage for hospital, skilled nursing, home health, and hospice. Part B is going to be your outpatient services like the doctor's office, ambulance, MRIs, CAT scans, all of that. There's some things that original Medicare doesn't cover. They don't cover comprehensive dental. They don't give you worldwide coverage, fitness benefits, routine eye and eyewear exams, routine hearing and hearing aid, outpatient prescription drugs. That's why you look at signing up for some sort of supplemental coverage. Medicare Advantage plans in Minnesota are going to offer you coverage on all these: dental, vision, hearing, medical, prescription drugs, fitness benefits. Some Medigap plans will offer you coverage for that, some won't. The initial coverage enrollment period begins 3 months before the month you turn 65, the month of, and then 3 months following. This is the time frame you have to sign up for Medicare Part A and B based on your 65th birth date. If you're going to continue working, you can delay that. And if you're working and your spouse is not, but your spouse is on your employer coverage, they can also delay their Medicare Part A and B at the time of their 65th birthday if they want to. One of the things we'll do is help compare your employer coverage to what Medicare offers. I just helped a lady with that the other night. And what she learned is her employer plan was much better for her and her husband to stay on that than to go on to Medicare. There's other times, this employer she works for happens to offer a very good medical plan. Not every employer does that. Some employers, you're better off to go on to Medicare once you turn 65. And that brings us to the next enrollment period. If you delay enrolling around your 65th birthday because you or a spouse continue to work, then you have what's called a special election period at the time of your retirement if you're past the age of 65. And that election period starts 2 months before you're getting ready to leave your employer coverage, and it continues for 8 months after that. However, you don't want to lapse in medical coverage. So if you are going to continue working past the age of 65, you would want to give us a call and meet with us 2 to 3 months before you plan to retire, and we can help you build that roadmap of getting enrolled in Medicare A and B, signing up for supplemental coverage so that there's no gap in your coverage between when you leave your employer plan and start Medicare. Then every year, once you're on Medicare, you have the annual election period, and that's going to be every year from October 15th through December 7th. You're going to have the opportunity to look at other options for yourself. If you're on a Medicare Advantage plan, those include medical, prescription drug, and all the extras. If that's changing or you just want to review your options, this is the time frame you have to do that. If you're on a Medigap plan, you can look at options. You can still look at options for Medicare Advantage or your prescription drug plan. You want to have that reviewed. And if you're on a Medicare cost plan in this area, this is the time you can have all of that due. If you're working with an agent that you love working with, I always say keep working with them. If you have an agent who you haven't heard from since you first signed up or you're not comfortable with, we'd be happy to work with you this fall on that. And then Another enrollment period that Medicare created a few years ago is called the Medicare Advantage Open Enrollment Period. If you're on a Medicare Advantage plan and during the annual enrollment period you thought, you know what, I'm happy with my plan, I'm not going to bother having it reviewed because I'm sure it's going to be fine for next year. And then you go to the pharmacy in January and find out one of your prescription medications that you're taking that was covered this year isn't covered next year, and you're going to pay the full cost. You have one more opportunity from January 1 through March 31st to switch from one Advantage plan to another Advantage plan, or to leave it all together and go back to original Medicare. But a lot of people don't know that this enrollment period is available. If you're on a Medigap plan, it doesn't apply, but if you're on a Advantage or cost plan, you can do this. So working past the age of 65, like I said, we can compare your costs and benefits based on your employer plan with what Medicare costs would be. We can ensure or take a look at your employer coverage is deemed credible. So as I said earlier, there's big changes to prescription drug coverage starting next year, and that change is going to benefit the consumer, where the government is requiring your prescription drug costs to be capped at $2,000. So if you're paying out a lot of money for your prescription medications, starting next year, once you've paid out $2,000, the insurance carriers are going to have to pay 100% of your prescription drug costs through the rest of the year. Because of that change, it's changing credible coverage for employer plans. So because that's the Medicare requirement, to be deemed credible coverage, if you're still on an employer plan, for your employer plan to be credible starting next year, they also have to offer you the option of the $2,000 limit on your prescriptions and then covering you at 100% after that. Probably getting into the weeds here, but it's a big change coming. If your employer plan is an HSA plan, then it's not going to be credible starting next year. So the importance of that is once you leave your employer plan and go on to Medicare, you don't want to have that penalty to pay. So just saying all that, throwing it out there. If you're in that situation, come talk to us because it's a big change for next year. One of the reasons why everybody who's on Medicare needs to have their plan reviewed, whether it's by us or your agent that you're currently using, because the prescription drug plans are changing quite a bit for next year. They're going to be dropping some medications and adding some, and you just want to make sure that you're going to be covered with your prescriptions for next year if you're on a plan right now. This is the form your employer would give you if you work past the age of 65 and then you retire. It's just a request for employment information. Your employer fills out the section, you fill out a section, and then when we help you sign up for Part B, or you just do it online yourself, you upload this form once it's completed, and then you won't have a penalty to pay once you sign up for Part B if you do it beyond the age of 65. Pretty simple form to do. We have that available. If you're in that situation, your HR people don't have it, we can send it to you. So the costs of Medicare. If you're high income, once you sign up for Part B, you could pay a high income surcharge for your Part B premium for the rest of the year. And high income this year is they base it off your tax returns from 2 years ago. If you're single and you file your taxes single and you made $103,000 a year or more, and that's modified adjusted gross income, you're going to be paying a high income surcharge. If you're married and filed jointly and had income of $206,000 a year or more, they're going to add on a high income surcharge. And you can see if it makes sense to you under the Medicare Part B column, your Part B premium is going to double for the first category, and then it continues to go up, and you would pay that for the rest of the year, and then they'll look every year if you're in that high income category for the next year and the next year. And eventually, if your income drops, you won't have to pay that surcharge. But it's not a lifetime, it's a yearly type thing. And it also applies to the Part D premium of your Medicare plans. But whatever your modified adjusted gross was from 2 years ago, so if you cashed in some whatever, and it really elevated your income 2 years ago, If you fall into that category, they'll add on a high income surcharge for the rest of the year when you sign up for Part B. Private health insurance options. So we have different options. You have Medigap plans. You have Medicare Advantage plans. So again, in McLeod and Meeker County, that includes Medicare cost plans, and then standalone prescription drug plans. We'll talk about Medigap plans. In Minnesota, they're called a little different than they are in most of the country. Most of the country, you're going to hear about Plan F, Plan G, Plan K, Plan N. In Minnesota, we call them basic, extended basic. We have a copay plan similar to Plan N, and then we have a high deductible plan. Your benefits are not going to change from year to year when you go with a supplement plan. Your premium will change, but your benefits will not. So if you wanted let's say an extended basic plan, this year you're going to be looking at, or any plan in that category, the monthly premium of roughly $250 to $300 a month or more for that. And then you would need to add on a standalone prescription drug plan because they don't offer prescription drug coverage. And then if you wanted dental, vision, and hearing coverage, you would need to buy policies to cover you for dental, vision, and hearing because Medigap plans don't cover that. The benefit of a Medigap plan is there's no network. Any provider that takes Medicare will accept your Medigap plan. It travels with you when you leave the state, which is nice unless you move permanently to another state because Minnesota's Medigap plans are higher priced than most of the rest of the country. If you were to go retire in Arizona or Texas or Florida, you're going to find Medigap plans for considerably less money per month than what it is in Minnesota. But you can keep your Medigap plan no matter where you live in the country. If you join a Medigap plan after 12 months of having Medicare Part B, you will be asked health questions. Compare that to Medicare Advantage plans or Medicare cost plans because you have both of those options in this area. Medicare Advantage plans are going to include your medical, your prescription drug, your dental, vision, and hearing, free gym memberships, over-the-counter benefits, a lot of extras that the Medigap plans don't cover. And as you mentioned earlier, those start at $0 a month and they can go up to over $100 a month or more depending on the plan that you want. You do need to use the plan provider's network. They're a lot better. So they came out in 2006 and Medicare Advantage, they weren't that good and they didn't have, some people still hold on to the reputation that Medicare Advantage plans used to have. At this point in Minnesota, you can get a Medicare Advantage plan where 95 to 97% of providers are in their network. They're going to include, for your monthly premium, they're going to include medical, prescription drug, dental, vision, hearing, fitness, a free membership at a gym, over-the-counter benefits. They're just loaded with benefits. Medigap plans don't have that, but they're much better, so much better than what they used to be in Minnesota. Minnesota's a little different. Even though we pay a little more for our plans, the networks for Advantage plans are much stronger here than they are in like Florida or Texas or any of the southern states. We have strong networks for the Medicare Advantage plans. You may hear people say, oh, stay away from Medicare Advantage plans because whatever. When they started in 2006, they weren't that great. They've gotten really strong in Minnesota and they're economical and they give you a lot of extras. But you do have a network, so we would look up to make sure your provider is in network if you chose to go with one of those plans. If it's an HMO plan, which I tend to keep people away from these days, you will probably need a referral to see a specialist. And if you're traveling with an HMO plan, you're not going to have as much access as you would with what's called a PPO plan. So in Minnesota now we have a lot of Advantage plans called PPO, Preferred Provider Organization. They give you coverage when you're traveling all across the country. You don't need referrals to see a specialist. So those are the options. If you go with a Medicare Advantage plan, in my opinion, you would want to go with a PPO plan because it's going to give you flexibility. Like I said, they give you a network outside of the state. If you go with a Medicare Advantage plan, they're based by county within the state where you live. So if you move to another county or if you move to another state, it's likely that you would have to find another plan option for you when you moved. Medicare Advantage plans don't ask you any health questions. You can enroll anytime during the valid enrollment period, and your plan benefits and premiums can change every year. They don't tend to change a lot, but they can. And then if you go with a Medigap plan or a Medicare cost plan, you would want to add on what's called a standalone prescription drug plan, because Medigap plans don't provide prescription drug coverage. So there's a lot of companies offering standalone prescription drug plans. The formulary is a list of prescriptions that they will cover for you on that plan. Each formulary and network are unique. Network meaning what pharmacies you can use. So when you meet with us and when you become our client every year, we want to review this for you because it's important for you to know the formulary changes on your prescription drug plan. You don't want to be surprised when you go to the pharmacy in January and find out something that they covered this year, they aren't going to cover next year. If you're taking something, a tier 3 medication like Jardiance or Eliquis or something like that, they're expensive. And you want to make sure your plan covers things like that because you don't want to be paying the full cost out of that. There are different tiers. So tier 1 and tier 2 are going to be generic medications in that formulary. Those are your lower cost ones. Tier 3 and tier 4 would be brand name medications. Tier 5 would be any specialty medications if you're taking, and then some plans have a tier 6, which is the lowest cost generic plans. When we go over all this with you, if we review your prescription drug plans for you, we're going to be able to tell you all of this, what tier it is, what your costs are going to be each month, if you're going to hit coverage gap and all of that sort of thing. So those are important things to know. And then again, for the changes for prescription drug plans for next year, this year there are 4 stages to prescription drug coverage. The first stage would be if you have a deductible. Not all the plans have a deductible where you have to pay the first $545 or whatever the amount would be. Not all plans have that, but if you have a plan where you pay a deductible, you pay that first. And then stage 2 is your initial coverage where you have co-pays when you go to the pharmacy, pick up your meds. You pay whatever the copay is. If it's a tier 1 generic, you probably don't have a copay, but if it's a tier 3, you probably have like a $47 a month copay for your medications. And then this year is going to be the last year for stage 3 coverage gap donut hole. If you hit the coverage gap or donut hole, that happens when the cost of your prescription drugs for the year reaches $5,030, and that's between what you have paid in copays and what your insurance company has paid for your medications. If you hit the coverage gap or donut hole, you're going to know because you're going to start paying 25% of the cost for your medications, either until the end of the year or until you hit catastrophic coverage. Catastrophic coverage happens once you've gone through the donut hole and between you and the insurance company you've paid out $8,000 for your prescriptions. Then you hit catastrophic coverage and then you're not going to pay anything for your medications through the end of the year. Next year, stage 3 is going to be the $2,000 cap. So you can see down at new in 2025, all medications will be capped at $2,000, and that includes the deductible if your plan has a deductible. So once you have paid out in copays $2,000, if you're in that situation, a lot of people aren't, but if you are, once you've paid out $2,000 for your medications, the insurance carriers are going to pay 100% of your medication costs through the end of the year. That's good news for people who've had high prescription drug costs in the past. Any questions on that? You guys are too easy. Okay, costs of Medicare. As we said before, Part A, you don't pay a monthly premium for Part A. If you or your spouse paid into the Medicare tax for 10 years while you worked. Part B, this year's $174.70 a month. Part C plans or Medicare Advantage plans start at $0 a month and can go up to $100 or more for a monthly premium. Medigap plans can start at $75 a month if you went with like a high deductible plan, or can go up to over $300 a month if you go with a plan where you don't have copays when you go to the doctor. With the Medigap plan, you would also need to add on a Part D standalone prescription drug plan. Those can start at $5 to over $100 a month additional for that. So you can see with your costs here, Medicare Advantage plans are more economical, but they're not always the right choice for everybody. So those are the things we help guide you through. Some people are more concerned about wanting to be able to go to any doctor they want to, and there's just a lot of questions that we ask to help you determine, do you want a Medicare Advantage plan, do you want a Medigap plan? They're both available to you. Any questions on anything I've said? Yes?
So if you're going to retire at 65, you're going to stop working, are you safe going with the Part A, B, C, and D if you're not really, maybe been hospitalized, well, probably not at all, through your whole 65,
Yeah.
years of working? Are you safe doing that?
Well, if you retire at the age of 65, you would need to go on to Medicare A and B and then sign up for supplemental coverage, whether it's an Advantage or Medigap. You would have to have, yeah.
Right, but then if you would sign up for the A and B and the C and the D,
Yeah. So
is that adequate?
it is, yeah. So the C and D is going to be an Advantage plan. If you go with Medigap, it'd be Medigap and then Part D. But if you've been in great health and you want to start with a zero premium plan like your mother moved to, you can do that, and then as your health changes, you have that option every year of finding another plan that's going to better suit you based where you are in life. But
And if you take two different prescriptions, say diabetes and
Yeah.
cholesterol,
Yeah.
will that be covered pretty good under
it
those
would.
plans?
So most of the generic cholesterol medications are tier 1, so that's a zero copay when you go to pick it up. Diabetes, it just depends. If it's like metformin, that's probably a zero copay. If it's something else, brand name, you're going to have a copay. But yeah, that's what we'll ask you for your list of medications when we meet with you to make sure whatever plan you decide on that you're going to be covered for your prescriptions.
And when you say retire at 65, so say July 1st, you turn 65 and you're you have to stop that July 1st, you should be signed up for everything by then, right?
Yes, so and as that timeline, you can start 3 months prior to the month of your 65th birth date. You can, if you're collecting Social Security, if you've signed up to collect Social Security benefits when you're 65, they will automatically send you your Medicare card, sign you up for A and B. If you don't want that for whatever reasons, there's instructions on how to suspend your Part A and Part B. But if you're retired and no longer working, you don't want to do that. If you're not going to collect Social Security benefits when you're 65, maybe you're going to wait till 67 or 70, then you would need to go online or go to the local Social Security office to sign up for Parts A and B. And that's something we can help you with too. But you would want to start that about 3 months prior to your 65th birth date, and then once you get your Medicare card in the mail, we can work with you to sign you up for whatever type of supplemental coverage you want. Okay, well, like I said, if you want help, whether it's because you're new to Medicare or this fall during the annual enrollment, if you want to fill this out, you can, and leave it with us. You don't have to. You have our contact information there. You're not required to fill anything out, but we would be more than happy to work with you. Like I said, if you're on Medicare now, you really need to have, I can't overemphasize this enough, you need to have somebody review your plans for next year because of the changes in the prescription drugs. You don't want that shock of going to the pharmacy and finding out something isn't covered next year that it was this year. So if you have a good agent, stay with them. If you don't, we'd be happy to work with you. But we'll be around for any extra questions if you don't want to ask in front of the group. But yeah, we'd love to work with you if you want us to. And here is our contact information, and you have it in your folders. Myself and Michaela, who's here.